So what is this? Now, what do people think about this? I don't know if we have any chat comments, and if anybody would like to comment. I would describe it as depressions or atrophic scars, at least in the first at the first glance. But and I don't know if people have seen those depressions on the forehead. We have a depression here. We have other depressions and a circular depression here. So what is that? And this happens 3 weeks after botulinum toxin injection. So these are morphea-like lesions that happen usually within 3 weeks of injection. In 3 cases, these lesions happened after injections to the frontalis muscle and resolved 2 weeks to 3 months post-development. And there was an older case where the injections happened after injecting, the complication happened after injecting the corrugator muscle. And I will show that case. Dr. Landau actually authored several cases of these lesions after botulinum toxin A injections, and they described them as morphea-like lesions, and it was an article in JAD case reports. And this is the case where the complication happened after injecting in the lateral aspect of the corrugator. This is the case by Zhao. In headache, we see all these depressions on the lateral end of the corrugator. And on the lower panel of sets, we see that the depression almost resolved after the botulinum toxin effect faded. So it's important to recognize these depressions and advise the patients accordingly. And this is a depression. I don't know if Dr. Landau has any comments on this one, but it seems like the mechanism may be similar. This is the so-called hourglass deformity of the temples after the injections for migraine. And we see that depression on the right temple here. And I don't know if Dr. Landau would like to make any comment on this kind of depression, or if you think, Marina, that this is the same mechanism as the morphea-like lesions.
I'm not sure, but because I did mention it in my publication, because when I was looking for pathogenesis, I was actually looking in every article published. So the authors of the articles, this article, do claim that it's to the transitory muscular atrophy. So it does not look as well defined as in the other cases, but the muscle, temporal muscle, is much wider and much deeper. So it looks that clinical presentation is different, but if you compare the post to pre, you definitely can see that the muscle has been atrophied due to the injection.
Right, and I think in the article it was more with the fanning injection technique, a kind of fanning technique, and I think it was also more prominent in people who didn't have a lot of fat in the area. They had thin temples. It was more prominent in those patients. Now, what causes these morphea-like lesions? The most likely mechanisms are a neurogenic atrophy, which means that the lack of neural stimulation to the muscle causes that muscle atrophy. And another postulated mechanism is the tissue reaction to silicone oil, which is available as a lubricant in the plastic syringe. And people think that dislocation of the lubricant during the botulinum toxin injection can bring the silicone oil to the skin. It's a theory that many people support, but I have seen little evidence to confirm it. And the difficulty with that theory is that you need to catch silicone oil in the tissue, and unless you do it in a specific way, the tissue detection is not very easy in the skin. So Carlos Wambier from my institution has used a flash technique to minimize the adverse reactions from syringe lubricant, the silicone oil. And it's interesting to read that article. But again, we miss a lot of data, and some authors disagree. There are articles that show that the silicone itself doesn't cause these reactions. Now, what is this injection causing? We see some nodules here, and I think that's kind of fascinating because many patients can be very, very stressed with this complication that can start the day after botulinum toxin injection. And I will go ahead and say that these are post-injection nodules. We have participated in a discussion, Dr. Landau and myself, about these nodules at IMCAS. The IMCAS alert cases have some of these photographs, and many people contributed to this discussion. And these nodules have developed with different botulinum toxins worldwide that all of them, almost all of them, were reconstituted in normal saline. Is this the same normal saline all across the world? We don't know, because there are many products, and I was discussing at a recent meeting, there are many products in other countries that are advertised as normal saline for use in the eye or for use in other areas of the body, that in fact they have many other ingredients. They're not pure normal saline, and they still have them in the pharmacy as normal saline, and some of them are used in the conjunctiva. So I'm wondering if all these reactions that are supposed to have happened with botulinum toxin reconstituted in normal saline was really normal saline without anything else. So these reactions...
George, if I can make a comment, because the cases presented here, I think 2 of them were actually reported on the IMCAS alert, complication alert platform, while this one was actually reported by a plastic surgeon from Mexico City when he saw this case, and it was one of a few that he saw at that time. He called me and asked him, what is it? And I just, first of all, asked him what was the reconstitutor, and it was normal saline. And the other question, I was trying to compare the batch that he's currently using with the one that I'm using, and it was not the same. Because the question is, as you so nicely mentioned, is whether it's a product or whether it's a solution that we use to reconstitute the product. So I don't have any answer to this question yet. But in this specific case, normal saline, reliable physician, and a batch, because he had the same few cases at the same time. I couldn't compare because I was using at that time a completely different batch.
Yes, so we need some answers to that, whether people who develop these reactions usually have only normal saline or something else in the normal saline. I think we need more data. And I was discussing with a colleague from Pakistan, Marina, a few days ago, who presented some similar cases at the AMWC meeting in Miami. I was discussing with her, and she didn't know if it was really the normal saline that we use in the United States or something else that this as a diluent that it was involved in these complications. So many patients, though, had uneventful previous or subsequent botulinum toxin injections, and thankfully they last only for a few days, these nodules. And as far as the pathogenesis, there have been 3 reports on allergic reactions which look urticarial, and those had systemic symptoms, and some of them did not have signs of a systemic reaction. And 2 were injected with Chinese botulinum toxin, and the authors of those studies thought it could be gelatin, the allergen, in these reactions. And 3 cases were reported in Curious as red itchy nodules, and they occurred 2 days to 3 weeks after botulinum toxin injection. And some of them were treated with topical antibiotic with steroid or systemic antibiotic with steroid, and subsequent Bonta injections were uneventful. I don't know what causes these 3 cases that we saw in the Curious article. It's important because these authors did not report any suspicion about any specific allergen. Now, we also saw in the literature some cases with the pathology of granuloma. It's hard to say that these cases that have the pathology of granuloma have the same pathogenesis with the other cases that were self-limited within a few weeks, because the pathology in this showed suburative sarcoid light or foreign body granuloma, and the lag time in these cases was 2 days to 6 years post-treatment. And of course, this case ran a more prolonged course, and I'm not sure that it's the same pathogenesis with the other cases, which were very self-limited. And I don't know if Marina would like to make any comment on these granulomatous reactions.
Yeah, probably they're not related to what we are talking. We are talking about something different. It's something which is occurring immediately after the injection. So there's no doubt about the connection between the procedure and this presentation.
So now tuberculous mycobacterial infections happen with many injectable procedures, fillers with botulinum toxin as well. And there was an article in the World Journal of Clinical Cases that reported 7 cases, and these infections manifested with multiple red papules, nodules, and abscesses. In 5 cases, the culture was positive for Mycobacterium abscessus, and a testing for drug susceptibility is important in such cases. Now, these infections are hard to treat with a single antimicrobial. We often combine 2 antimicrobials for best results, and in such cases, a combo of clarithromycin with doxycycline is effective. And this is another case, another rare complication. And we see here livedoid changes in the forehead. And that was a single case, but it was quite impressive that this happened after botulinum toxin. This complication usually happens after a filler, because a filler can cause a vascular occlusion, and the vascular occlusion can cause livedoid changes. But in this case, it happened after botulinum toxin injection. And the injection caused central forehead ischemic injury, again from an arterial occlusion. And the injections were classically in the glabella with a 30G tuberculin syringe, as we usually do for Botox. So the discomfort occurred first on the left central forehead, and over 72 hours, there was skin discoloration and tenderness. And on day 3, livedoid changes were noted. So that was quite probably the first case to see an arterial occlusion from botulinum toxin injections.
Actually, it is not, because when I looked at the literature, I think it was 2019, it was a publication on vision loss following masseter injection by
And no, I
botulinum.
have that. I have that.
Okay, sorry.
Yeah, I do have that after that. The vision loss, I have it as separate. So this is on the skin, actually. I think I was talking more, Marina, about the skin. For the skin, it was probably the first case. Now, as far as the mechanism, people think that it's microcores of skin tissue in the needle that could have created an intraarterial embolus upon the next injection. It's hard to prove it, but there is something in the needle that probably causes an embolus. That's the only thing we can assume. And the management in this particular case was 3 hyperbaric oxygen sessions, and it worked very well. Now, the case that Marina refers to is a case of visual loss that was noted 4 hours after botulinum toxin injection in the masseter. And it was reported many years ago, 2018, I think, in the International Ophthalmology. And the patient experienced right eye visual acuity decrease to 20 out of 800. And the injections were in the masseter. So the masseter is far away from the eye, but it seems like it's not far away because of the collateral circulation and the complexity of the vessels. And in this case, people think that botulinum toxin may have a prothrombotic effect secondary to an interaction between the neurotoxin and the endothelial cells. Other authors think that it is the vascular wall injury by the needle that can induce a thrombosis, and then there is retrograde travel of the embolus from an anterior branch around the masseter towards the central retinal artery. So many theories about that. Is this a prothrombotic effect of botulinum toxin? Hard to believe because it hasn't been noted in other cases, or is this the vascular wall injury? Most likely that induced that thrombosis. And again, how was botulinum toxin injected? If one pinches 10 times in the same area, could it be a very severe vascular injury that can generate a thrombus? Again, no proof, but these are the mechanisms that have been speculated. And this resolved with systemic steroid treatment over 2 months after botulinum toxin. But it's very amazing that one could see a visual loss case after botulinum toxin, especially since the botulinum toxin was injected so far away from the glabellar area. So blanching was only reported recently, and it was a case in the Journal of Cosmetic Dermatology of temporary facial blanching after botulinum toxin injection in an Asian female. And that was noted several hours after receiving the injection and resolved 96 hours after the injection. Looking at the literature, we found 3 more cases, and actually they were also reported in the article, of similar blanching that was reported by other authors from 2013 to 2022. And I don't think we have an easy explanation of that complication either. People think that it could be the inhibition of acetylcholine that botulinum toxin causes. And however, why in this case we have blanching, while in other cases botulinum toxin is well documented to cause vasodilation? Why in this case we have a blanching effect? Could it be stabilization of hyperactive blood vessels? There are many theories, again, in that same article. I don't think the article manages to address it, very convincingly, what happens and why in this case we have a blanching, while in numerous other cases we have vasodilation. And the management, according to the authors of that paper, is to use lower botulinum toxin doses, especially if the patient comes to us for the first time and inject away from vascular network, and that's not easy at all, and ensure a thorough mixing and dilution of the botulinum toxin. I don't think we have any way to prevent this, in my opinion. I think these are the management options, the management suggestions of the authors, but I'm not sure if any of this is at all feasible. Now, the last complication that I will present is the pseudoaneurysm of the superficial temporal artery. And that's the anterior branch, actually, of the artery that goes from the superficial temporal artery, its arterial branch that goes towards the frontalis muscle. So we see here that at the intersection of the frontalis and the temporalis muscles, there is a specific area where the artery is uncushioned. That means it lies over the periosteum and it's easily exposed to pinches. And that's where the pinches can occur through from the botulinum toxin. So this is the danger zone that I show here with the purple circle. And again, it's at the intersection of the 2 muscles, and where the artery is unprotected practically there. And the fascia tethers the artery towards the periosteum, and it limits the displacement of the artery, so it's easy to pinch that artery because it's bound to the periosteum. So there are 2 cases that showed that this complication developed 2 and 6 months after Bonta, and the lesions were felt like masses at the sites of injection. And what can we do? If that happens, the treatment is the management is this, of course, through vascular surgery, surgical resection, ligation, sclerosis, ultrasound guided thrombin injection, and coil embolization have been used by vascular surgeons to eliminate those masses. The only thing we can do to prevent this from happening is just not to pinch too harshly in that particular area. And generally, we should not pinch too harsh any injections against the periosteum, because the recent cases show that the needle can go through the periosteum. There has been a recent study that showed that also with fillers. We should be more gentle when the needle touches the periosteum, especially not to push too hard.